A tissue is a group or layer of cells working together to perform a specific function. Tissues are classified based on the size, shape, and functions of their cells. The four main types of tissue are epithelial, connective, muscle, and nervous tissue. Epithelial tissues cover the body and line cavities, organs, and tubes, and are also found in glands. Their structure supports functions like protection, secretion, and absorption. Epithelial cells are closely packed and lie on a basement membrane. Epithelial tissue can be simple, meaning a single layer of cells, or stratified, meaning several layers of cells. Simple epithelium is divided into three main types: squamous, cuboidal, and columnar epithelium. Squamous epithelium is a single layer of flattened cells that fit closely together, forming a smooth membrane. This allows for easy diffusion. It lines structures like the heart, alveoli of the lungs, and kidney nephrons. Cuboidal epithelium consists of cube-shaped cells on a basement membrane. It forms kidney tubules and is found in some glands. Its active functions include secretion, absorption, and excretion. Columnar epithelium is a single layer of rectangular cells on a basement membrane. It lines many organs and is often adapted for specific functions. For example, the lining of the stomach is simple columnar epithelium. Microvilli cover the surface of columnar epithelium in the small intestine, increasing the surface area for nutrient absorption. In the trachea, columnar epithelium is ciliated and includes mucus-secreting goblet cells. Ciliary action propels ova in the uterine tubes. Stratified epithelia consist of several layers of various shaped cells. New cells from the basal layers replace those shed at the surface. Their main function is to protect underlying structures from mechanical wear and tear. The two main types are stratified squamous and transitional squamous epithelium. Stratified squamous epithelium is composed of multiple cell layers. Deepest layers are columnar, and as cells move toward the surface, they flatten and are eventually shed. Keratinized stratified epithelium is found on dry, wear and tear-prone surfaces like skin, hair, and nails. The surface layer contains dead cells with keratin, forming a tough, waterproof protective barrier that is continually replaced from below. Non-keratinized stratified epithelium protects moist surfaces subjected to wear and tear, preventing them from drying out. Examples include the lining of the mouth, pharynx, esophagus, vagina, and conjunctiva of the eyes. Transitional epithelium is composed of several layers of pear-shaped cells. It lines the urinary bladder, allowing it to stretch as it fills. Connective tissue is the most abundant tissue in the body. Cells are widely separated, with large amounts of intercellular substance or matrix, and often fibers. Functions include binding, structural support, protection, transport, and insulation. Loose or areolar connective tissue is the most generalized type. It has a semi-solid matrix with various cell types and elastic and collagen fibers. It provides elasticity and tensile strength, connecting and supporting other tissues throughout the body. Adipose tissue consists of fat cells in an areolar tissue matrix. White adipose tissue stores energy and acts as a thermal insulator. Brown adipose tissue present in newborns produces heat when metabolized to maintain body temperature. Lymphoid tissue, also known as reticular tissue, has a semi-solid matrix with fine reticulin fibers and contains reticular cells and white blood cells. It is found in lymph nodes and all organs of the lymphatic system. Dense connective tissue has more fibers and fewer cells than loose connective tissue. Fibrous tissue, a type of dense connective tissue, is mainly closely packed bundles of collagen fibers. It forms ligaments, protective coverings for organs, and muscle sheaths. Elastic tissue is capable of significant extension and recoil. Its matrix consists mainly of elastic fibers. It is found in organs that require stretching or shape alteration, such as large blood vessel walls, the trachea, bronchi, and the lungs. Blood is a fluid connective tissue that circulates throughout the body. It transports oxygen, nutrients, cell wastes, hormones, heat, protective substances, and clotting factors. Blood is composed of plasma, a watery fluid, and suspended blood cells. Plasma constitutes about 55% of the blood volume, while the cellular fraction makes up the remaining 45%. Blood accounts for about 7% of body weight. There are three main types of blood cells: erythrocytes, which are red blood cells, platelets, also known as thrombocytes, and leukocytes, which are white blood cells. Cartilage is firmer than other connective tissues. Its cells, called chondrocytes, are embedded in a matrix reinforced by collagen and elastic fibers. The three types are hyaline cartilage, fibrocartilage, and elastic fibrocartilage. Hyaline cartilage is a smooth, bluish-white tissue that provides flexibility, support, and smooth surfaces for joint movement. It is found on the ends of long bones, forming costal cartilages and parts of the larynx, trachea, and bronchi. Fibrocartilage is a tough, slightly flexible supporting tissue with dense masses of white collagen fibers in a matrix. It forms pads between vertebrae, the semilunar cartilages of the knee joint, and deepens the bony sockets of the hip and shoulder joints. Elastic fibrocartilage is a flexible tissue with yellow elastic fibers in a solid matrix. It provides support and maintains the shape of structures such as the pinna of the ear, the epiglottis, and part of the tunica media of blood vessel walls. Bone cells are surrounded by a matrix of collagen fibers strengthened by inorganic salts, providing strength and rigidity. Bone has a considerable capacity for growth and regeneration. The two types are compact bone and spongy or cancellous bone. Muscle tissue contracts and relaxes, enabling movement within the body and of the body itself. Adequate blood supply is necessary for muscle contraction. The three types of specialized contractile cells, or fibers, are skeletal muscle, smooth muscle, and cardiac muscle. Skeletal muscle is striated and voluntary, meaning it is under conscious control and moves the bones. The fibers are cylindrical with multiple nuclei. Contraction is stimulated by motor nerve impulses. Smooth muscle is non-striated and involuntary. Cells are spindle-shaped with one central nucleus. It contracts and relaxes with intrinsic ability, stimulated by autonomic nerve impulses, hormones, and local metabolites. Contraction is slower and more sustained than skeletal muscle. Smooth muscle is found in the walls of hollow organs. Its functions include regulating the diameter of blood vessels, propelling contents in the alimentary tract and ureters, and expelling contents from the urinary bladder and uterus. Cardiac muscle tissue is found only in the heart wall. It is involuntary and striated. The cells have branches and are in close contact through intercalated discs, giving it the appearance of a muscle sheet. The end-to-end continuity of cardiac muscle cells allows a wave of contraction to spread across the intercalated discs without individual cell stimulation. The heart has an intrinsic pacemaker system, ensuring coordinated beating. Nervous tissue includes two types of cells: excitable cells called neurons, which initiate, receive, conduct, and transmit information, and non-excitable glial cells, which support the neurons. Thank you for watching this video on tissues, their types, and functions.